Good afternoon, everyone. I'm Joanne Starks of SEDL, or SEDL, in Austin, Texas, and I will be moderating today's webcast on Undertaking Reviews for Policy. The webcast is offered through the Center on Knowledge Translation for Disability and Rehabilitation Research, or KTDRR, which is funded by the National Institute on Disability and Rehabilitation Research, NIDR, in the U.S. Department of Education. I want to thank my colleague Ann Williams, our webinar administrator, for her logistical and technical support for today's webcast. A reminder that we will ask you to complete a brief evaluation at the end of today's webcast. I'll give you more instructions following the presentation. And since the slides are small on the screen, it might be helpful to download a copy of the PowerPoint file from the KTDRR's website at www.ktdrr.org. The Center on KTDRR is working with a number of national and international partners, and we are pleased to count the Evidence for Policy and Practice Information and Coordinating Center, EPPI-Centre, among those partners. The EPPI-Centre is part of the Social Science Research Unit at the Institute of Education, University of London. Since 1993, the EPPI-Centre has been at the forefront of carrying out systematic reviews and developing review methods in social science and public policy. Today's webcast is the third in a series of webcasts presented by the staff from the EPPI-Centre. In the first webcast, the founder of the EPPI-Centre, Professor Ann Oakley, and the current director, Professor David Guff, described how the EPPI-Centre got started, identified some of the benefits and problems of evidence-based policy, and discussed various types of research reviews. Professor Sandy Oliver and Ms. Rebecca Reeves presented the second webcast that focused on the status of the use of research results today and how to get more reliable and relevant research into use. Today, our presenters will examine motivating policymakers to use research and what types of reviews are most useful in the policy arena, the impact of time constraints, and strategies when the research is thin and policy-focused reviews. Now, I'd like to introduce today's presenters. James Thomas, PhD, is Professor of Social Research and Policy in the Department of Childhood, Families, and Health. He is Director of the EPPI-Centre's Reviews Facility for the Department of Health, England, which undertakes systematic reviews across a range of policy areas to support the department. His research interests include systematic reviewing, methods for research synthesis and research more broadly, the use of new information technologies in social research, evidence-informed policy and practice, and health promotion and public health. He specializes in developing methods for research synthesis, in particular for qualitative and mixed methods reviews, and in using emerging information technologies such as text mining in research. He leads a module on synthesis and critical appraisal on the EPPI-Centre's MSc in Research for Public Policy and Practice, and development on the Center's in-house reviewing software, EPPI-Reviewer. Professor Thomas is also co-assistant director for health and well-being at the Institute of Education. Katy Sutcliffe, PhD, is a research officer and member of the Faculty of Children and Learning, Department of Childhood, Families, and Health. She also works with the EPPI-Centre. Katy joined SSRU in 2002 after completing a master's degree in social research methods. Her research interests include systematic research synthesis, evidence-informed policy and practice, synthesizing qualitative research, children with chronic conditions, and children's participation in healthcare decision-making. I will now hand things over to Dr. James Thomas to start today's presentation. Dr. Thomas?
Hello, and thank you for inviting us to participate in this webcast. Katy and I have got a few slides to go through where we're going to think about some of our experiences in helping policymakers to make use of research, and in particular the Reviews Facility Programme that we've been involved in with the Department of Health England for over a decade now. So our first slide gives you an outline for what the session is going to be about. We're going to think a little bit about what it means to help policymakers to use research, and then the implications of this in terms of adapting review methodology to meet their needs, being responsive to their needs, thinking a little bit about what we do where their evidence base is not as sufficient as perhaps we'd like, and also thinking about what this means in terms of bringing research processes in line with the timelines which are more usually expected in terms of policy development. So to start with, I'll hand over to Katy, who's going to talk a little bit about helping policymakers to use research.
Thank you, James. So to begin, as you would have already seen in the talk and presentation that Sandy and Rebecca gave, research evidence is just one of the sources of information that policymakers will typically use when making decisions, and quite often it's a source of evidence that's quite low down in the long list of advice from experts and pressure groups and other sources when making decisions. So how can we make research evidence more appealing for policymakers? One of the things that we can't dispense with is the methodological rigour that is required, especially when assembling evidence to support policy at a national level. But in order to make the research more appealing to policymakers, we need to adapt the approach so that the research and the evidence that we assemble is relevant. And this means addressing a diverse range of research questions that policymakers ask. And in order to answer those questions, we have to make use of a diverse range of types of evidence. In addition, and again we refer you back to Sandy and Rebecca's presentation, we typically involve a wide range of perspectives of users, so not just policymakers, but perhaps service users and other interested parties. In addition to having a relevant focus for our reviews, we also need to make sure that what we produce, the report and the way that we share findings, means that that evidence is implementable, it's translated, it's relevant for the context or practice settings that policymakers need to address. We also have developed and tailored our methods so that we can be more responsive to their needs. So there's an ongoing dialogue with policymakers whenever we do a review so that we can respond to their changing and evolving needs, which are typical throughout a review. And finally, we've developed methods and ways to ensure that we can, as James has already said, address their needs as and when is required. So quite often we are asked to respond quite rapidly.
Thanks, Katy. I'm going to talk a little bit about the context now within which we've been working, and I'm going to try and use one of these tools at the top of the screen here. So this little picture here on the right describes the structure within which we work and within which we operate. So this box down here is us, the reviews facility, and we work directly and indirectly, but I hope more and more directly, with policy teams, senior policy makers at the Department of Health. And one of the things that's quite unusual about the setup that we've got, and certainly unusual in terms of our experiences with other government departments, is there's this part of the department called the Department of Health Policy Research Programme, the PRP. And what that does is it's got a sort of a mediating, knowledge brokering type of role within the department. And it commissions research and it talks to policymakers throughout the policy-making process. And it's a sort of an institutional way of ensuring that knowledge is mediated between us, which is at the moment the faculty, but also we could think of academia and other knowledge producers more widely, and the policy teams, which are at the top here. So I wanted to highlight this arrangement because I think it's quite unusual, certainly in terms of our experience in this country. And I don't know many other countries which have got this arrangement with a specific and well-funded knowledge brokering service within a government department. So we've been doing this, as the previous slide said, since about 1995. And to begin with, we had a fairly clear programme of work which was around systematic reviews of effectiveness in health promotion, where our work, and this was based on wording from a previous slide from years ago, was around transferring and translating the model of evidence-based healthcare to health promotion and public health. And we did a series of reviews in sexual health, smoking, workplace, and they're all on our website if you want to have a look at them. And we had quite a lot of engagement with policy teams over the years, and they were positive about these reviews, but they wanted more assistance than this straight translation could offer. They asked questions that preceded and went beyond effectiveness. And we found that increasingly we were needing that for each review we had to customise the approach to meet their needs. And this was part of the point of the programme, that this engagement between policymakers and academics was developing new ways of understanding what the evidence base had to say on a particular issue. And so we found that we had to push these boundaries of review methods in order to answer the range of questions that the policymakers asked.
Thank you, James. So there, moving on to the next slide, we have pushed methodological boundaries in a number of ways, and thinking about what we might consider to be a traditional model of a systematic review, typically asking questions about what works or what's effective, we have found that in assembling evidence on policy relevant issues has meant that typically the kind of evidence that we're uncovering and using is not necessarily the trials or randomised controlled trials that have been the evidence used in a typical systematic review, and therefore even within standard or reasonably standard systematic review types of questions, the evidence types we are using have been different, and therefore we've had to develop methods, for example, to include a range of evidence types, evaluating interventions such as studies that examine before and after an intervention, or perhaps cluster randomised controlled trials. So we've had to push the boundaries within the typical type of evidence included in systematic reviews. But in addition, the kinds of questions that policymakers are asking of us go way beyond questions of effectiveness. Therefore, we've had to develop methods in order to accommodate those types of questions and the appropriate types of evidence for answering those questions, such as process evaluations to illuminate what the barriers and facilitators of implementing an intervention are, or survey research looking at the nature or extent of a given problem within a population or a context, or qualitative research, views research about what people need and what their experiences of services or contexts are, and correlational studies looking at relationships between phenomena. There's been a range of methodological development for individual study designs and review questions. And if we move on to the next slide, so the methods for appraisal and synthesis, as we've just described, differ or need to differ according to the nature of the included evidence to ensure that the methods are fit for purpose. However, going beyond those individual innovations, the reviews that we are typically asked to do involve more than one type of question and therefore more than one type of evidence. So another way in which we've had to adapt review methods is by adopting mixed methods approach and developing methods to combine different types of evidence. And in particular, one of the things that we've needed to do is when we've looked at large data sets, trials, for example, on how effective interventions are, combining that macro level evidence with evidence from users and from members of the public, or in qualitative research about what their experiences are. So blending these two very different types of evidence, we've been developing methods to accommodate that. And throughout all of this, we do emphasise that we needed to maintain key principles of research synthesis and make sure that the approach is transparent and rigorous and not biased in any way.
Thanks, Katy. Now I've got a couple of slides that summarise some of this in pictorial form, starting on slide 9. So thinking about what people might think of as traditional systematic reviews of effectiveness, we've got a question which a policymaker will ask, which is around what the evidence is to inform this particular policy decision. So stepping back from that slightly, we might be asking a question around which interventions work best in this context. Okay, so that's an answerable question, but if we think about what a normal systematic review or a traditional systematic review might look like, what it tends to do is look at the effectiveness of a particular treatment versus a control. And so what we need to do in this situation, where we're looking at a broad questions around which interventions work best, we need to look at multiple systematic reviews. So we've got 2 over here for systematic review of treatment B, treatment A, treatment C. Sometimes you get them treatment A versus control, treatment B versus treatment C, etc. But these tend to be fairly narrowly defined and fairly tightly scoped reviews. And that contrasts really with the policy question, which is less around the effectiveness of a single intervention, but which is wanting to know which interventions work best. So it requires looking across multiple reviews. We've got them over here. And obviously there might be more than one review. We might be looking at primary research. We might be looking at other sorts of research. In order to get towards answering a slightly more nebulous question, which is what is the evidence to inform this particular decision. So we find, to begin with, that in order to address policy questions, that an individual systematic review, such as treatment A versus B, is insufficient, and actually what we're needing to do within the same review is look at which interventions work best in a particular context, which involves looking at multiple different treatments, different intervention options, in order to identify which is best in a particular context. And that's a particularly critical part of this process, that part of the engagement which we need to have with the evidence base is not simply in terms of looking at the effectiveness of an intervention in context A, but actually what we're needing to do is assist the policy teams in terms of thinking about translating and the applicability of that particular evidence within the policy context within which we're working. As Katy said in the previous slides, that it gets more complicated than this, because actually policymakers tend not to ask simple questions, if there are any simple questions about effectiveness, but they ask questions around the extent of the problem or the nature of the problem. So one of the reviews that we're working on at the moment is looking at the extent and the nature of medication error among children. And so that's a very different question, and it precedes questions of effectiveness. We're looking at literally at the nature of a problem, the extent of a problem. And then, of course, we've got another area that Katy's touched on, which is what people's perceptions of the problem are, which is critical when we're thinking about what interventions might be appropriate, what might be relevant in a particular context. And then another question which we're frequently asked is, what are the barriers and facilitators to implementation? So, okay, we've got some kind of an answer to which interventions might work best in this context. We might know something about the extent and nature of the problem, but actually we need to then start thinking about what the implications are of implementing such an intervention program within our particular population. So what we find is that when we meet with policymakers, that they're interested often in which interventions work best in their context, but that's really only one part of the problem. Actually, what we're needing to address is the nature of the problem, what we're going to do about it, what's acceptable, what people's understandings are of these problems, and what are the implementation issues. So moving on to the next slide on tobacco sources, Katy's going to take us through an example of that type of review activity.
Okay, so this is a review that we worked on several years ago now, but it's a nice example of what James was describing there, the breadth of the types of review that we're typically asked to do. And this particular review, we were asked to explore how young people, which we were defined as age between 11 and 18, how they access tobacco in the United Kingdom, i.e. what ways did they use to obtain cigarettes, given that it was illegal to purchase cigarettes below the age of 18. So in order to address this rather broad question, we conducted 3 interconnected syntheses. The first was to examine the extent or nature of the problem. So we undertook a statistical meta-analysis of survey data from young people in the UK with the aim of revealing the most common routes of tobacco access. So you can see there that the method that we used is highlighted in blue, and the type of data we used, survey data, is highlighted there in green, and the aim of that particular piece of work highlighted there in red. We also conducted, the second synthesis that we conducted was a thematic synthesis, and the type of data we used there was qualitative research from young people in the UK with the aim of revealing the barriers and facilitators of tobacco access. So what helped or hindered people, young people in obtaining cigarettes. And lastly, the Department of Health was interested in finding out what might work to reduce tobacco access. But actually, in conducting the review, we identified that although there were some evaluations of interventions, there were very few of high quality, and none, I think, which were actually conducted here in the UK. So they had perhaps little contextual relevance for what was going on here in the UK. But we decided to use the qualitative research from which we identified what the barriers and facilitators of tobacco access are, to explore whether those intervention studies were addressing the problems that young people in the UK identified, and whether they were addressing the particular routes of access that young people in the UK were using and identified in the survey data. So although we stopped short of being able to say what works, we were able to say how relevant existing interventions might be for the population of interest. What's not mentioned here, but is an important component of this review, was actually we went beyond those 3 syntheses and conducted a further piece of work which involved consulting young people on the validity and the relevance of the findings that we developed, and how they saw how relevant they found those findings and how valid they found those findings. In particular, that was a useful component given that we were examining qualitative evidence on their views and experiences, and what we found that actually they were very their views and experience tally very much with the findings that we had. So it was an extra validation of the work. So it was quite a broad-ranging piece of work involving a number of very distinct and different methods, and bringing all of that research together. And moving on from the example to the next slide. One of the things that we found we've needed to do in doing these policy relevant reviews is not only adapting research methodology to address the range of questions and evidence types that are important, but also adapting our ways of working and approaches to be sure that we can be responsive throughout a review to the policymakers' needs. So at the outset, we work closely with policy teams in order to develop a conceptual framework and write up a protocol, ensuring that we have a shared vision and clarity about what the scope of this review is, about what it's going to focus on. We also make sure at the outset that we understand how they intend to use the findings of our review, to be able to be sure that when we write our reports, we frame the evidence in a way that can be most translatable or useful for their needs. We also work with them to determine how quickly or how soon they might require all of that evidence, or indeed a part of it. In some instances, we've provided one portion of the evidence much sooner than the rest of it because they've needed it particularly quickly. But also we developed a range of methods for responding rapidly to a request, and James will touch a bit more on that in a moment. During a review, quite often we'll work quite closely with the policy teams in order to make changes in the direction of the review. One of the ways that that's done is that we set out to do that by initially scoping or mapping the evidence landscape, if you like, so determining all of the possible evidence that could answer a question in a particular policy area. And then, once we've described the nature of all of that evidence, focusing down on a particular portion of that evidence. So, for example, mapping all of the different research designs relating to a particular topic or policy area, and then just focusing down on one or two of those particular pots of evidence. Also, we've worked with reviews in a more organic fashion in changing direction as policy priorities shift, perhaps with a change of government or particularly an issue that's come to the policy for a particular time. Or quite often we've found that we've gone down a particular tack and there's not enough evidence in that review to make it a viable route of inquiry, and we've changed tack. And as I've mentioned before, we've provided staged outputs, and they've been useful in making clear with our policy customers, is the evidence that we've assembled what they expected, is it presented in the way that they expected so that they can use it, so that we tailor and refine the way we deliver the findings as we go along. Also, after we've done a piece of work, we've often gone back and done supplementary pieces of work. So, for example, when we've assembled evidence on a range of interventions and how they might work, we've been asked to go back and say, well, we now know which of these interventions we might like to work with and develop, but what can you tell us about what are the best ways to implement that? And as I mentioned in the example of the tobacco sources review, we've also gone back post-synthesis and done consultations with service users or groups of young people to be sure that our findings are valid.
Right, so thinking on some of those points that Katy raised, we're going to think a little bit about what we do when the research evidence is thin. And of course, identifying gaps in the evidence is useful, and one of the ways in which we do this is to conduct systematic maps, systematic searches of the literature, which are broader than you might put in a systematic review, but then describe the range of research activity in a given area. And that helps us and policy teams to think about what might be useful avenues for exploration. And there's a debate in the systematic review community on the utility of empty reviews. There's a Cochrane Opportunities funded project at the moment which is looking at the utility of empty reviews. And empty reviews have a role to play in terms of scoping existing research activity and identifying gaps in the evidence base, which then need to be filled by further commissioned research. And I think this might describe some of the differences between the systematic reviews that we conduct, which are specific for policy development and for specific policy developments at that, and for systematic reviews which are aiming at informing the evidence base more generally. While of course we publish our reviews and they get picked up in places other than the Department of Health policy teams, we don't regard empty reviews as being a useful product for use at that moment in developing policy. Obviously they're useful for describing that more research needs to be done, but policy teams need to make a decision. And so what we aim to do is to identify the best available evidence, avoiding empty reviews, even if that we have to say, well, actually there's no evidence on effectiveness in this particular area. We can still find evidence of a different type, which helps policymakers think through some of the issues, think through some of the implementation issues, think through some of the acceptability issues that might help inform their decision making. So obviously we have to be careful when we use a less restrictive quality threshold to increase the volume and coverage of data, and we have to frame our results more cautiously and describe the limitations of evidence in a particular area. But we do find that in discussions with policy teams that they're grateful for any pointers that we're able to give them, even if we're not able to answer an effectiveness question directly. Other evidence types are able to illuminate the issue, as Katy described in that example review. The other point that Katy's raised earlier is about responding quickly, and this is about matching the research timetable, which typically can take a year and more to do a large, broad review such as the ones we've described, and the response which sometimes are needed in order to meet a particular policy deadline. And this is why a facility like ours is sort of in existence or set up in the first place, so that we're able to move quite quickly and to synthesize evidence to high standards, even if what we're addressing are broad, complex questions. This has required methodological innovation over the years and quick and fairly rapid dialogue with policymakers at times in order to identify what are both useful solutions for the policy teams as well as still meeting what we see as important criteria in terms of the rigor of the synthesized product that we produce. So we undertake rapid evidence assessments where we sometimes restrict the search, or we might restrict the dates that we're looking at. Sometimes we restrict the locale, so we look specifically at use case policy and related similar policy areas, or similar countries with similar policy environments. We're trialing the use of text mining to automate the identification of relevant studies in reviews. And as there are more and more reviews conducted and available out there, we're finding that we're able to review existing systematic reviews to assemble evidence from a range of different contexts. And the type of activity that this involves, we find is quite different to conducting a systematic review. We still conduct systematic searches in order to identify an unbiased, or as unbiased as we can, set of reviews. But we're less involved in developing and creating new knowledge as we might in a systematic review of primary research, and we see ourselves more as mediating the research which is available in existing reviews. So we quality appraise the existing reviews, and we summarize some of the findings and tailor them for the context in which the policymakers are working. But there's less synthesis in a review of reviews than there is in a review of primary research. And the other way in which we respond quickly, or we aim to meet the timetable of policymakers, is staging the outputs. There have been quite a few reviews now where we've identified what the particular policy development timetable is, and then mapped a synthesis timetable against that, so that we've identified either particular areas, topic areas which the policy team might be working their way through, which we've done with one review, or in a more recent review where we've delivered different parts of the review which are thinking about different parts of the policy development timetable. So we identified and synthesized evidence around the extent and the nature of a problem. We then moved on to identifying evidence on effectiveness of interventions to address that problem, and we're now moving towards synthesizing evidence around implementation as the policy team considers the range of the problem, what they might do about it, and then the implementation issues which might affect any particular decisions that they might make. So I think that takes us through to our conclusion. So I'll hand over to Katy here.
Thank you, James. Yes, so really just to conclude, to cover all of that wide range of activities and ways in which we've adapted what you might call a typical or traditional systematic review approach. There are two essential steps, we felt, if we could boil it down, to ensuring that review findings are relevant for policy and that their findings can then be implemented. And the first of those is to maintain a dialogue throughout the review and to work closely with policymakers and with a range of other advisors to understand what what the important questions are, what do they want to know, but also how do they plan to use the findings so that the product can be tailored for use. And the second is to be creative in thinking about how you can apply systematic review methodology and push the boundaries of systematic review methodology whilst maintaining rigour. And that's, I think, threaded throughout the presentation here today, is that although we have been creative in the way that we've worked, this has always been the bedrock of what we've done, that we had to maintain the rigour that is the standard of systematic review methodology. And just to say thank you very much. And
well, thank you. We really appreciate a very interesting presentation today on the EPPI-Centre's efforts in the area of systematic and other reviews for policy impact. And thank you to everyone for participating in today's webcast. Before we close, let me ask if either of our presenters has any final words for the audience today.
I think we do on the next slide. Yes, we do. So if you're interested in what you've heard and you want to know more, then please do visit our website, which you can see the URL of here, and I'll use the little tool again there. Yeah. And of course, we couldn't leave without plugging our book. So if you've not come across it and are interested in a broad-ranging approach to conducting systematic reviews to inform policy and practice decisions, then obviously we'd recommend our book, which is called An Introduction to Systematic Reviews. Thank you.
thank you.
Thank you again very much. We have the book here, and we've been referring to it frequently, so I definitely would encourage people to take a look at the book. It's very readable, and I think a really good overview of the topic. So we hope everyone found today's session to be informative. As a reminder, the webcast will be archived on the KTDRR's website at www.ktdrr.org. We also have a brief online evaluation form and would appreciate your input about the webcast. The link is here on the last page of the PowerPoint file, and everyone who registered will also get an email with a link to the evaluation form. And once again, a big thank you to our presenters today, Dr. James Thomas and Dr. Katy Sutcliffe of the EPPI-Centre, from the staff at the Center on KTDRR. We also appreciate the support from NIDR to carry out the webcast and other center activities. On this final note, I'll conclude the webcast and invite you to participate in future